One of the most heartwarming experiences when taking care of orphan kittens is bottle feeding them, especially if it goes without a hitch. Bottle feeding does require some planning ahead of time to set yourself and the kitten up for success. The first step in feeding an orphan kitten is getting an accurate weight before attempting to feed. This is important so you don't overfeed the kitten. Feeding kittens free choice may result in regurgitation, aspiration, and diarrhea if they consume beyond their stomach capacity. Underfeeding can result in poor weight gain, which is a risk factor for increased mortality. The next step involves calculating your kitten's stomach capacity to determine the daily caloric requirement. To compute this exactly, there is an excellent chart available on our website called Feeding and Stomach Capacity Table. Here's the web address to access this chart. Step 3 involves preparing the equipment. Select a nipple that is the correct length for your kitten's mouth and not greater than 5/8 inch in length. Anything longer may place the nipple too far back in the kitten's mouth, risking aspiration of the milk. There are several options to prepare the nipple. You can poke a hole in the nipple with a hot needle, or you can cut a snip in the tip of the nipple. My preference is to use the snip method. The goal is to allow a slow drip from the bottle with a slight squeeze. Avoid cutting too far down the nipple, as that may create a stream of milk coming out too quickly. You should also have a bottle and syringe for measuring out the milk. I don't recommend feeding with a syringe, as you may inadvertently syringe too much milk in for the kitten to swallow, which may also result in aspiration of the milk. Thoroughly clean the equipment in very hot soapy water or boiling water and allow them to dry completely. Next, follow the instructions on the formula to prepare the milk. Most powdered commercial milk replacers will have you dilute 1 part powder to 2 parts water. However, you may want to dilute the milk for the first few feedings using an oral electrolyte solution low in sugar like Pedialyte, or you can use water. This will ease the kitten's digestive adjustment to the formula. The milk should be warmed up to about 100 degrees Fahrenheit, approximately the mother cat's body temperature. Avoid warming the milk up in the microwave. Instead, warm the milk up by placing it in the warm water bath. You can warm the water bath in the microwave, then soak the milk in the water bath for a few minutes, or however long it takes to warm the milk up to 100 degrees Fahrenheit. You can test this easily by dripping it on your wrist. Measure out the calculated volume by using the syringe or measurements on the side of the milk bottle. Try not to go beyond the calculated volume for stomach capacity, even if the kitten still appears hungry after feeding. An important part of this step is making sure the kitten is not chilled before feeding. Kittens that are chilled tend to be less responsive and not as interested in nursing. Follow these steps to position your kitten before feeding. The kitten should be in a sternal upright position, not cradled like a human infant. The neck should be slightly flexed and stretched out like he's reaching for his mother's nipple. Try not to allow the kitten to extend her neck back, as that will shorten the gullet and predispose the kitten to aspiration of the milk. Some kittens will prefer to stand up, which is fine so long as the kitten's neck isn't crimping. You can also wrap the kitten in a blanket like a burrito, allowing only his head to stick out. Now for the fun part, feeding your kitten. Check the temperature of the milk once again by dripping a few drops of milk onto your wrist. Sometimes the rubber will stick after cleaning, so make sure to unstick the rubber openings when preparing the bottle by dripping a few drops of milk out before feeding. If the milk feels too hot to your wrist, it may be too warm. Cool the milk by swirling it around the bottle and check again before attempting to feed. If the milk feels too cold, the kitten may refuse to nurse. Next, allow a drop of milk to drip onto the kitten's tongue. The kitten should latch on pretty quickly, but it may take a few attempts before she figures it out. Be careful not to squeeze the bottle and stream milk into the kitten's mouth, as the kitten may aspirate the milk. Continue to carefully drip milk onto the tongue without it streaming. Many kittens will get very vigorous with their front legs and accidentally knock the bottle out of their mouth. The key is to hold the kitten gently and move with the kitten as necessary. Don't hold the kitten too tightly. If after a few attempts the kitten does not latch on, don't force the feeding. Make sure the kitten is warm enough and the milk is warm enough, and try again. If the kitten is warm enough, try again in a half hour to an hour. Some kittens will skip a feeding once in a while, but if this becomes a pattern throughout the day, then you may have a sick kitten that needs veterinary attention. Make sure to burp and stimulate your kitten after each feeding until such time as it is able to urinate and defecate on its own. The last step in feeding your kitten involves cleanup. Be sure to thoroughly wash all the equipment between feedings with very hot soap and water and allow them to dry completely. Extra milk can be stored in the refrigerator for up to 24 hours. Try not to store it for more than 24 hours if possible. Formula is an excellent breeding ground for unwanted bacteria. You can check out the Orphan Kitten Feeding and Stomach Capacity Table and the Orphan Kitten Feeding Issues, Consequences, and their Prevention chart on the Maddie's Institute website for more information.